Let's bring into the conversation Alfie Stirling, as Head of Economics at the New Economics Foundation. I see now how they've arrived at the figure of £13, but do you think it's going to be a game changer here? Good morning.
Good morning. I'm afraid I don't think it will be. I think there's two really big problems here. One is the one you've already identified in your interview with the Secretary of State earlier, which is this just won't have the desired impact.
No.
This is about ensuring that people are partly, yes, protected financially while they stay at home, but also making sure they can make that choice to stay at home and not go into work when they've been asked to self-isolate. And £13 a day is less than 1/5 of median earnings in the UK. It's a trivial sum. It's not going to have that impact. But more widely, we've had now for months government say that there's absolutely nothing that needs to be done to UK social security. There's no strengthening that needs happening. And then to jump in with this very small payment for a 14-day period at maximum shows they can't see the wood for the trees. With the ending of the furlough scheme in October, the Office for Budget Responsibility, the government's own fiscal watchdog, they're expecting unemployment to rise to 4 million by Christmas. And these 4 million people are going to be met by not only one of the weakest safety nets in northwest Europe, but one of the weakest in the UK's own history as well.
Obviously, there is a problem because the government are keen to get the level up to 80%. Currently, they claim they're in sort of low 70s. How do you think they might achieve that actual goal?
Sorry, 80%
of getting people who need to be tested and traced. They reckon they're reaching around 8. They want to get to 80% of the people they need to test and trace or track and trace, whatever you want to call it. Currently, they're saying they're getting the low 70s. They see this, particularly in areas such as Leicester, Blackburn and Darwin and Oldham, they see this as the game changer. What do you think might work better?
Well, there are two key elements on that. One is actually getting the test working, reaching the people, getting those diagnostics done. And the second is having got that information, the extent to which policy is effective at isolating people. And this is about the second of those. So there's a whole question around whether they can get those percentages up. There's a big problem at the moment in terms of shifting the main public health agency and reforming it and changing it just at the time when they need to be recruiting and expanding the workforce is going to hamper those efforts to expand test and trace capacity. But then the problem we now face is that having told people to self-isolate, having told local regions to go into lockdown, if people can't work, they're going to be financially incredibly insecure, and payments like this don't plug that gap.
Grateful for your time, Alfie Stirling. Thank you, Head of Economics at the New Economics Foundation. Now,